So, one of the main reasons I based my research project on general anxiety disorder is because anxiety and depression are the most common mental disorder in Britain, with 7.8% of people meeting the criteria for diagnosis, and 40% of disability worldwide is down to depression and anxiety. In 2013, there were 8.2 million cases of anxiety, which means 4 years later, it's going to have increased. So there's more awareness on general anxiety disorder. However, there needs to be new programs, which is why I wanted to focus on cognitive behavioural therapy, because it has got high success rates and it has a different approach to other therapies or medicines, which focus more on the repressed negative memories, and it's trying to find the root problem. But it's very intense and it takes a very long time in order to see any improvement or results. I wanted to focus on children because 5.9% of 13 to 18-year-olds, which would be perceived as adolescents, have a severe anxiety disorder, which is quite alarming because it's not just a small, mild anxiety disorder, which means this is going to worsen unless they're given the correct treatment. Also, according to a 2015 Children's Mental Health Report from the Child's Mind, it found that 80% of children who were diagnosed with an anxiety disorder are not being given the correct treatment they need, which can then go on to affect problems with them in their social life or with their mental ability or their education or their relationships later on in life. Some of the problems and the dangers of not being diagnosed early enough is that they may develop new anxiety disorders or symptoms, or they may develop these in adolescence, which will go on to affect them in other cases such as work, employment, relationships. They may go on to lead to substance abuse and use because they have no way of dealing with their memories or dealing with their pain. They're at risk of also developing a depression, and the more severe and the greater the impairment of functioning, the more likely the anxiety is to persist. So cognitive behaviour therapy is different from other forms of treatment because instead of focusing on trying to find the root problem and trying to work backwards through the patient's life, it instead just focuses on their current problems, their day-to-day life, and it tries to find new ways and strategies to deal with problems. So when a situation arises in which the patient feels uncomfortable or they feel like they're becoming anxious or unsociable, they can find new strategies and techniques to deal with these up front instead of trying to dig back into their past, in which it will bring back bad effects. It can bring up physical side effects such as migraines or dizziness, and they can then go on to affect their social life and their work and their job, and it's more exhausting. It takes a longer duration of time. It takes a long time before you see any sort of success or any sort of results, which is why in other forms of therapy such as EMDR there's an extremely high dropout rate, whereas CBT it usually takes 2 to 3 months. It tends to be 10 to 16 weeks. It's a weekly session, 1 hour session, in which the patient will talk about their problems and the therapist will help try and devise new ways they can deal with them. There's a lot of cognitive strategies of self-talk, problem-solving techniques, self-reinforcement of brave behaviour. There's also a lot of emphasis on relaxation strategies. And then the patient will then go home, but they will have to go home with homework. So they have to reinforce these things that they spoke about and talked about into their everyday life. And the same goes with parents. So the parent will go home with the child and they will try and make time to make maps and diaries to note when they feel a certain way and what's brought this problem about, so they can try and put in the strategies they spoke about with the therapist in order to help them deal with the problem there and then.